My name is Eric Kazarian. I'm an otolaryngologist, head and neck surgeon, also known as an ear, nose, and throat doctor, and one of the relatively few surgeons in the world that specializes in the surgical treatment of snoring and obstructive sleep apnea. In this video, I will discuss conservative measures, also known as behavior changes, and positive airway pressure. There are four main categories of treatment options for both snoring and obstructive sleep apnea. With snoring, we often are less aggressive with treatment because we do not need to overcome actual blockage of breathing. But conceptually, I think about treatment of both snoring and sleep apnea with the same overall approach. Within that approach, snoring and sleep apnea treatment is not just about having a single treatment for everyone. Different factors play a role in different patients. This is not well understood by many people, including most physicians and dentists. The key to successful treatment is finding out why someone has snoring or obstructive sleep apnea and developing a treatment plan that is right for them. The first category of treatment involves changes in behaviors. These are not always easy or simple, but they can be very helpful. A major cause of snoring and obstructive sleep apnea is weight gain, and patients who are overweight or obese can really benefit from weight loss. Weight loss, of course, also has general health benefits, which is why it is so important for those who are overweight or obese. Unfortunately, with sleep apnea, weight loss can be especially challenging. Many patients with sleep apnea can be so tired that they do not have the energy to exercise, and research has also shown that sleep apnea may affect appetite and metabolism in ways that are not completely understood. Patients often ask me how much weight they need to lose to clear up their snoring or sleep apnea completely. And the short answers are that nobody knows for sure and that it differs for different people. One guide can be based on whether the snoring or sleep apnea started only with weight gain, and losing weight to get back to the level before the weight gain is generally a good place to start. For example, if everything started when you gained 10 pounds, losing those 10 pounds often will get you back to where you were before the weight gain, or at least close. To eliminate significant obstructive sleep apnea, we do know that typically people have to lose a fair amount of weight. On average, studies have shown that a 10% weight loss, so 20 pounds for someone that weighs 200 pounds, will reduce the number of times per hour that people are having blockage of breathing, what is called the apnea-hypopnea index, by about 25%. So someone with blockage of breathing 20 times an hour would expect to see a decrease to 15 times an hour. This may be enough of an improvement, but it may not be. Usually my patients and I end up pursuing weight loss in combination with other treatments. Sleeping on our back tends to be the most problematic position for snoring and obstructive sleep apnea. One reason is that gravity works against us. When we are in deep sleep, our muscles are especially relaxed. Since our throat is basically a tube surrounded by muscles and soft tissues, when we are on our backs and asleep, with those muscles relaxed, the structures around the throat, such as the soft palate or tongue, can fall back more easily and cause snoring or blocked breathing. For some people, there's quite a big difference between sleeping on their back versus on their sides or stomach. There are many ways we can learn about that. Some patients have figured out themselves, or have been told, that they snore less or just wake up feeling more rested when they sleep on their sides. They may be aware of getting a sharp elbow in their back during the night, telling them to roll off their back and onto their side, but sometimes the only clue comes from a sleep study, which can tell what breathing patterns were when they were sleeping on their back, sides, or stomach. Some patients are forced to sleep on their back, whether due to medical conditions affecting their neck or back or some other reason. But some patients fall asleep on their sides or stomach and then roll onto their back at some point during the night, maybe because their shoulder gets sore. One simple but effective treatment involves wearing a t-shirt at night with a pocket sewn up high on the back between the shoulder blades big enough to hold 2 tennis balls, or even baseballs. Basically, what can happen is that a person sleeping on their side may have their shoulder get sore and roll onto their back, feel the tennis balls in their back, which is not so comfortable, and then roll onto their other side. Once someone gets used to staying off their back when they sleep, they may be able to stop using the special t-shirts with tennis balls. The last behavior change is avoiding alcohol and sedative medications at night, especially within 2 or 3 hours before going to bed. Basically, alcohol and sedatives relax muscles even more than would naturally occur with sleep, making an individual more likely to snore and have blockage of breathing. Studies show that alcohol also reduces the deep sleep that people get and can lead to waking up earlier and having a hard time falling back to sleep. So alcohol works against us on multiple levels. It is not necessary to avoid all alcohol, but minimizing it within 3 hours of bedtime is almost always a good start. The next category of treatment is positive airway pressure therapy in its various forms such as continuous, bilevel, or automatic positive airway pressure. This is generally used only for obstructive sleep apnea. This treatment involves equipment, including a machine that functions something like an air compressor, tubing, and what we call an interface, which is some method of getting that air to a patient, whether with a mask going over the nose or the nose and mouth together, nasal pillows that are placed inside the nostrils, or other options. Positive airway pressure is the first-line treatment for almost all patients with moderate to severe obstructive sleep apnea because it can work well and has relatively low risks. Positive airway pressure can improve health and sleep quality, and it can improve or eliminate snoring too. Although I'm a surgeon, I'd like to stress that it is a great treatment option. I have some personal friends who wear CPAP and do well with it, and their wives love it too. However, positive airway pressure therapy does not work if you are not able to wear it or sleep comfortably with it. A common question is how much someone has to use CPAP to get its benefit, because many patients can only wear it part of the night on some nights. The short answer is that someone with sleep apnea should wear it all night, every night, if at all possible. For those who do not do as well with it, there is actually very little evidence evaluating how much use is enough. It appears that at least 4 hours a night, on at least 5 nights a week, provides some benefit in many patients. However, more use is better. There are a number of reasons why people can have trouble wearing CPAP, and I will often work with patients, their sleep medicine providers, and their medical equipment companies to see if there are things we can do to make CPAP more tolerable. The solution could be everything from opening up the nasal passages to making adjustments in the equipment or settings, to name just a few possibilities. My approach is to work as a team to do everything possible to help patients wear CPAP more often, but to recognize that if they are not wearing it, they should consider other options. I hope you've enjoyed this video and continue to watch the other videos that explore the full range of surgical treatment options and how I evaluate patients to select the best procedures that might work well for them.